So we are live. We are in the third day of INDUSCON 2021. I am here with Professor Ahmad Barari from University of Ontario, Institute of Technology from Canada. Good morning, Professor Ahmed.
Good morning, Professor Suzuki.
Yeah, it's a great pleasure that we start the third day with the keynote speech from Rodrigo Silvestre. Currently, he is chief economist and owner of the company Demon Planning and Control. He was director of the Industry Complex and Innovation in the Health at the Secretariat of Science, Technology, and Strategic Inputs of the Ministry of Health. He was also industrial director of the Paraná Institute of Technology. And in this talk entitled Innovation Challenge in Health Sector and the Perspectives of the Unified Health System, SUS, in Brazil, he will discuss the major challenges and opportunities to Brazil after the COVID-19 pandemic in the perspective of the unified health system. I'm going to call here Rodrigo Silvestre. I'm just finishing your presentation, Rodrigo. This speech will be done through an economic perspective designed for broadening the engineer order view. The Brazilian health sector is a complex ecosystem of industries, very dependent on science, technology, and innovation. Therefore, it's a rich environment where engineers contribute to improve results related with the health of the Brazilian population. We are very excited to hear you, Rodrigo Silvestre, and thank you very much for accepting our invitation. It's an honor to have you here. Please make use of the word.
Good morning, everyone. Professor Marcos, Professor Ahmed, it's an honor to be here to share some knowledge about this so challenging environment that is health sector in Brazil. I used to be director in some government laboratories and also worked in the central planning of this industrial complex. So it was a great opportunity to bring this kind of discussions to engineers, because we have a very dependent industrial tissue in Brazil. So we need to invest more, and that's what we're going to talk about a little bit today. Let me.
I can put your presentation here?
Please.
Okay. Thank you.
Okay. So what we saw with the pandemic, that was we always, when we need some fast responses from the industry, we most often cannot have it, because we need to adjust and set the production with a large period of time. So in industrial sector, in health sector, we need at least 3 to 4 years to establish a new production line with all the certifications and good manufacturing practice. So what we saw in the pandemic was, from the regulatory perspective, it was almost a miracle. We fortunately could deliver good quality vaccines, as we saw in the first day with Butantan and his great team of researchers and industrial workers. And then what we need is to think that this kind of situations like this COVID pandemic will always happen. So we have to prepare. We don't know the characteristics of a specific pandemic, but we know how they behave in average. That's what we have to address our planning and our health system to deal with this kind of challenge. a little bit. So what we have to think about when we're dealing with these innovation challenges, it's that we have some short-term challenges and some long-term challenges. Related with the second type, we have some trends that are very important to plan our health sector. One of them is related with the population aging. This caused a major shift in the prevalence of the diseases. So we migrate from a low income diseases to a large income in diseases that was we no longer need to treat smallpox or worms, and we started to deal with diseases like cancer or immunosuppressor, autoimmune diseases that request some kinds of strategic inputs that have higher costs and have a major impact in the public sector is when you have a system like unified health system. We also have a science and technology gap in Brazil. We have good efforts investing in science, technology, and infrastructure, but we still don't have meaningful results related to the health sector concerning to new molecules or new medical devices. We still depend from the knowledge coming from abroad. So it's related with our lack of innovation policy. We have some directions to the related with innovation in Brazil. We have a legal framework here, but we have still have a lack of clear objectives related with this policy. And the major interest of all is that we are seeing the diffusion and the introduction of this 4.0 industry. So we need to know how it's going to impact and change our health sector, and how we can seize these opportunities to improve the results to our health sector and to bring to our economy development and make the labor posts we need. So there are several opportunities here that we can discuss a little bit. So the first is that once our population becoming older, we started to see kinds of diseases like cancer and autoimmune disease that demand some kinds of drugs that are like monoclonal antibodies that are very, very expensive treatments. So once the unified health system have the obligation to supply for all the population this kind of medicines, we saw after the year 2008 and 2010, the introduction of some medicines just to have order of the magnitude. They represent 2% of the quantities of the medicines purchased by Minister of Health, but they represent 50% of the spenders. So it's a huge impact. and they are prescribed only by a small fraction of the people. So when you project and you think about the major impact when you have the replace when you replace all the conventional treatments by these new kinds of technologies, the budget of the Minister of Health can no longer support this kind of introduction. So, but we cannot avoid our population to become older. So we have to plan, we have to deal with these characteristics. One of the strategies is to improve our industrial sector to provide this kind of drugs here. So even if they still very expensive, but the resources related with these expenditures will be here in the Brazilian territory and not be sent elsewhere. So we are a continental country, so even if we saw in the southern part of the Brazil the increase in cancer and autoimmune diseases, we still have to live with the remaining tropical and neglected diseases. So we have some controversies here in Brazil that if we have to introduce new and very expensive drugs like for rare diseases that can cost about $2 million one vial. And also we still have malaria, we still have dengue fever, we still have some diseases that are characteristics here in Brazil and have a huge impact for a not insignificant group of the population. So how we deal with these very new technology drugs and this very old technology requesting the diseases. What I think is that we can use our knowledge, especially our knowledge in industrial and engineering manufacturing, to produce new ways to achieve these same old molecules. So if we have no innovation related with the molecule to treat dengue fever or malaria or other of our diseases, we still have lots of room to improvement in the ways they are produced. They're especially toxic, difficult to make the cleanup or the setups of the facilities. They cannot be used alongside with all other drugs. So how we, as engineers, can think about fast setup, how to produce small quantities, how to deliver quality insurance, things that are very difficult to achieve without huge industrial facilities or quality guarantee teams. So if we cannot put these costs into the price of these old medicines, how can engineer produce new ways or new technologies to reduce these costs or to improve their qualities, to guarantee that once the unified health systems request these kinds of medicines or treatments, they will be available. It's one of the challenges relating with these topics. And the last of these is that we are experiencing a diffusion of all other kinds of treatments, like healthcare, home care systems, and precise medicines that are very tricky for the unified health systems, because uh, they cannot be supplied without information about who is receiving and what kind of treatment he is using, who is paying the costs. So this kind of decentralized treatments will improve, and there's also room for us to provide informations about this, to remote assistance to this, how we're going to make maintenance, how we're going to assure that the informations that the Minister of Health needs will be supplied. All these things are going to change the relations between engineering and the health sector. But if we're facing these shifts in the demand side, we are also seeing the shifts in the supply side. And in the supply side, this is very closely related with the investments in science and technology that are made in the leader countries in this sector. We saw that once the science evolves, we have a deeper knowledge about how the system, the biological systems works, how the medical devices can interact with biological devices. So this allows us to use the investments in science and technology to achieve innovation and to improve the economic perspective. But in Brazil, we have a gap, because we have a very good quality in our science. We have a good capability in our industry to produce this kind of technology. We have quality, we have productivity, but we cannot bring those kinds of things together. I don't really know the answer. I just know that if we saw that we have all the parts and we have the demands, we have the necessities, why we cannot saw the answer, and why some kind of researchers, engineers, and scientists outside of Brazil can solve the answer. That's what we have to deal with. So I think one of the ways is we have to improve our relationships, to understand that the health sector in Brazil is huge, but he is not outside of an international industry and an international health complex. We are very entangled, so that's we need to think about how we're going to occupy some spaces, but we don't need to think that we have the whole industry will be here in Brazil. We will need to have some parts of them to supply sometimes a new drugs, etc. That's why we need to think about long-term development projects. That's why, because those drugs that we are buying today in the Minister of Health was developed like 50 years ago. Ironically, some researchers there in 1970 were Brazilians. We have Professor Khalil from Butantan, which is a major specialist in antibody, in monoclonal antibodies. We have also other researchers here in Bahia. And why we invested in those researchers? They made these contributions for this huge discovery, and 50 years after, we are buying these same drugs by the retail price in the market. So something was missing in this period of time. So we need to think about this. Those kinds of long-term investments are high-risk investments. That's why our entrepreneurs in Brazil are not very well familiar with this kind of investments, and it's a choice. They have to choose those projects. And once we have a very strong financial sector in Brazil, we have sometimes a very high opportunity costs related with invest in long-term projects, even with high return rates that we can find in health sector, but they have high risks. When we go to the other subsector in this health industry, we have the medical devices that have smaller costs of entrance. So it's possible for a new engineer coming from the graduate school to start a company for a new medical device. But what the problem here, it's the lack of standardization. So once the sector use the differentiation to be their competitive strategy, they say that if each medical device is unique, therefore we have very large problems to purchase this in the public sector in Brazil, because it's difficult to establish what's the core of the medical devices, what's really needed, and what's just some features to differentiate or to get a minor improvement in treatment. So this is why we still have very small companies here in Brazil to medical devices, and still depends on the large conglomerates to supply these kinds of medical devices. So, as we saw, we have some major trends that are already being saw and already being taught. We have a technology and science gap that needs to be narrowed to improve our results, economic and development results, and how the other countries and the other champions of the sector achieve this kind of results. Most of them proposing in a clear manner an innovation policy. Sometimes a national innovation policies bringing more than one sector, and sometimes specific innovation policies. That's what we're talking here. We need a specific policy for innovation sector, for innovation in health sector. 2 days ago, the Minister of Science and Technology in Brazil released a public note with some kind of infra legal framework ordinance. So in this ordinance, they propose the prioritary sectors to Brazil. If we saw the document, you see that we're proposing to be good in every sector, to be good in industry, culture, and as also we're going to do Internet of Things and cybersecurity. It's impossible for any nation to be good in everything. We cannot have a broad focus, or we have a focus, or we have a broad vision, because otherwise we're going to have lots of examples, we're going to have lots of cases or pilot projects, but we will never achieve the sufficient amount of people, enterprises, and resources to spread the results all over the country. Then we will use the innovation to generate more inequality. That's what we have to avoid, because innovation, it's a competitive strategy. It's not a policy to spread the wealthy or the results. Otherwise, innovation is to concentrate in the leaders some temporary extraordinary profits that will generate the incentives to others to produce the same products. So we need to address clearly in these national innovation policies. That's what I'm working with several people today to improve our legal and infra-legal framework to be more clear to the entrepreneurs in the health sector in Brazil, how they can innovate, how can they use the tools available today in Brazil to have more competitive companies, to address problems we have in the health unified sector, and how we can establish in national level some objectives, some priorities. We can select some sectors. We cannot be, we did this in the automobile sector. We have defined some strategies. We don't have national companies, but we can have the multinational companies here, generating jobs here, making investments in science technology here. This was deliberately a result from the investments made before. It's not an spontaneous results. So that's what we need to address this clearly in health sector. Why? Because, as Schumpeter said, there are some moments in the history that we produce or experience some destruction. They call this the creative destruction. And in Brazil, we associated this idea with the creativity and the production of new ideas, or how to share the ideas to make the open innovation. But I think, as economists, that what Schumpeter said, it's related with the after some moments with huge destructions. That's what we saw in the SARS-CoV pandemic, that the resources, the inputs, the personnel are become idle, become without use. That's why once the entrepreneur come with a new idea, they can fast retrofit those resources that are not being used to produce to produce new processes, to produce new products and services. So now we have two great opportunities coming together, and that's what I think we need to seize. One, it's the supply side changes that come with the 4.0 industry diffusion. That's opportunity to think a new industry to Brazil. In this new industry, the engineers need to be very active, because it's not enough anymore just to develop new technology. We need to understand how this technology we're going to be used in a non-technical environment. So it's very it's very common and it's normal to an engineer to introduce some sensors to improve their own work. But how we're going to deal with the sensors in the physicist, in the hospital, providing informations, and how they're going to have a more fluid relation with the gadgets or with the equipment, that they don't need to have the engineering every time to set up the equipment. But otherwise, how the engineer, we're going to see the physicist using the sensors and use these informations to develop the new kind of sensors. So how the information, the multidisciplinary information, we're going to change the ways the physicists do their jobs. Because now we are we have a very passive position when we engineers deal with these automations. We propose the introduction of computers. That's the third revolution. It's to bring the technology to the spaces of the others. But in the fourth revolution, we're going to bring down those barriers. So it will be impossible to say if the cure came from the use of the cyber physical system or the use of the knowledge of the physicists. They will be result of all these things together. So we need to use this moment post-pandemic, this moment where we basically reduce the participation of the industry in our gross national product, and to think about a new industry. We cannot recover our 19th century industry. We need to produce a new one. And once we have the healthy unified system, we have a huge opportunity to create a new industry based on this health sector. To illustrate some things I just said, I would like to bring some examples. One of them, it's the ecosystem in the state of Ceará. They choose deliberately the health sector as a prioritary sector. So they have the innovation districts They are three innovation districts. Some specialized in services, others in biotechnology, and others in medical devices. So what they saw once the pandemic stressed the Ceará health system, they respond with a gathering of competences in the state to solve what they need and how to address these needs. And they flourish in innovation. They they first could make the maintenance of mechanical ventilators that were very needed in the the peak of the crisis. They developed a helmet to avoid the people need to go to more intensive care units. They also saw that what's happening there, what's not just a casualty, just some arbitrary results. They saw they have a innovation movement growing there, and then they searched for some outside consultants, just like me, to to say how they can put this information in a more bureaucratic and formal manner, and how, and then we can tell to them that we have the legal framework for what they are doing. Then they started to think about their innovation policies, they how to protect their inventions, how to measure the results for the unified health system. This is a small scale conjunct of actions, that a set of actions that can be used in national scale. And in national scale, we already have the legal framework. From especially in the last 5 years, we had very well written legal framework, so we can use it. But unfortunately, we're not in a very good moment in economics. So our entrepreneurs are avoiding risks now. But I think there in Ceará was a very good example. The other one, as we saw in the first keynote when Butantan made their speech, we started in the year 2008, 2009, some partnerships with the private sector to produce those monoclonal antibodies here in Brazil. They're not innovative products in worldwide, in world scale, but they are very important for the unified health sector in Brazil, and they are innovative for our industry. So as a manner to make the catch up with these leaders, like the multinationals in health sector, the government here in Brazil proposed some public callings and some legal tenders where they can purchase the drug, and also to stimulate the manufacturers of the drugs, most of them the innovators that was first researched the drug, to transfer those technologies to the public laboratories in Brazil, like Butantan, Fiocruz, Tecpar, FUNED, and others, but also to transfer for a private company in Brazil. So they can do this even if the public company, if the government laboratory can not reach the goals, the private sector in Brazil will meet those goals. So they started to invest in their facilities. They started to build their factories here in Brazil, and to understand and to introduce these biotechnology platforms in Brazil. Not only looking for those products for the short term that already are being consumed in the SUS, but looking to through those platforms to achieve innovative molecules. So once they learn how to produce, once they have the facilities ready to produce those kinds of products, they think, and we also think, they will have learned how to try to produce their own molecules. That's what we need. And that's where the engineers have a very, very good place to work, because those kinds of platforms are very relies very much in the information infrastructure and sensoring and automation. We need to achieve high standards of qualities, to have the minimum intervention, human intervention. So the dream is to have a totally automatic facility where we don't need to have no personnel working near of the production lines. So to automation, it's our paradise. We need to go there. We need to develop new solutions, because if we rely every time in a sensor that have to come from Europe, every time I have to make a maintenance in my line, we have setup times, we have costs, we have stopped in the production that will undermine our productivity. So we need to, again, to work together with those who need this kind of productions. Also, we have a very recent legal framework related with startups. So if we not valorize enough our engineers, the engineers have the obligations to start to entrepreneur themselves. So we can, of course, we're not expect that our engineers are going to start a multinational pharmaceutical company. But once we're investing in new power, in new facilities, in new factories, there's room for identify some minor components, minor systems that can be developed for a startup and provide for a major company. So we can organize our ecosystem around those major companies to supply them with new technologies, new sensors, new services, not to be the major product. We don't need to discover the new molecule to be a successful entrepreneur in health sector. But if we know how to make a new sensor that can be used in the production line to provide information to improve the quality of that molecule, it will be a huge success for a startup. So how we can in discussions and spaces like this in INDUSCON to propose for our engineers to see themselves not always as an employee, how they can also be an entrepreneur. How can we contribute to reduce I'm sorry. How can we reduce those almost 15 million people in Brazil that have no jobs? So we need to have more companies. We need to have more uh, efforts to bring this technology to produce invoices. The technology only in the bench, it's not enough. We need to put it outside. And that's it. I think that's what I'm going to address, and we can use the remaining time for some discussions.
Thank you very much, Rodrigo. It was really exciting and nice talk. And I can see that you have some questions here. I'm going to just put it in the screen. If Brazil has to invest in innovations only in select few sectors or just in few sectors, and pointing that it has some natural strengths, do you think that healthcare can be one sector that they will innovate? So it's more or less a comparison between the natural strength and health, like a balance. What do you think when you compare these 2 points? What
It's a
do you
very
think?
interesting point because we can choose the sectors because we're strong, but we also need to choose those where we have a huge demand. So
Mhm.
even if we don't choose health sector as a prioritary sector, we will still have the demands. We will still have the needs. So someone else will have to supply this. So uh, first, I think yes, we have great companies producing generic drugs. We have universities with very good quality in their researches and personal formation. That's why I think it is a very important sector. But I don't know why we cannot increase the participation of the health sector in gross national product. I don't know why we always have this around 80 or 90% for the centuries. We don't know why, but and we're trying to move. So I think health sector it's important, not only because we have strengths in the sector, but we are the biggest public sector in the world. So the demand of supplying strategic inputs for more than 100 million people, it's a necessity. And that's why we need to choose the health sector.
Mhm. I can see also you just talked about universities, and you pointed also during your talk, but a connection between engineer and medicine in the formation of the medicine or in the formation of the engineer. Perhaps in the engineer is more relevant and more active than in the medicine. Also can bring or reach innovations in this field. For example, Escola Politecnica has a course, not a complete course, but a module on bioengineer. created just a few years ago. Well, this is a small initiative, but this course, we have several students that they are willing to go there. So it's always a complete field. And what I can also point in this question is I think it's missing some hub where we have some facilitators to integrate the source of innovation that is like startups that you said and faculties, and where's the demand? How this or do we have some facilitators where this connection can happen in Brazil?
Yes, only just to complement to that what Thiago Martin said. Yes, Thiago, it's also true for other sectors, not for every sector, but I think we once we narrow the set for a smaller quantity of sectors, we will have to choose between equivalent sectors. We will not have a final question. Oh, we have to choose health sector because no other one it's like this. So in a point we have to choose, but it's yes, it can be applied to other sectors, that's environment, etc. Uh, as Professor Marco said, I think the word it's broker. We need brokers in Brazil in different kinds of ways. We need brokers between universities and companies to use their technology to have their patents going to the market. And we need brokers between the Escola Politecnica and Hospital das Clínicas to translate the information between them, because their necessities will never be the same. But once we have the third part that have one necessity, it's easier, I think, to bring this broker together and say, oh, these people need this kind of things of the physician and this kind of things from the engineer, and then the broker can make them the talk and address the problem, because otherwise we always have to the balance pending from one of the other sides. In the same it's valid for talking between government and universities and enterprises. We need to produce this kind of people capable of be more generic in the speech, but more capable of discuss with different kinds of competencies.
Thank you for the answer, Ahmed. Yes, I think you have a question. You are muted, please.
Yes, I think it's a very important uh, piece of the puzzle, what you mentioned about the brokers. But there is something else also that just make me very curious about the format of this system, and I think is related to this discussion as well. The issue is here we deal with the major factor that always happens in industries, and that's customer satisfaction and customer trust. And we saw that even happen for COVID. For the case of COVID vaccination, still there are a lot of people, they don't trust the vaccines. They don't get this trust to even try these vaccines. So customer trust needs a stronger backup. Like, because when people can trust the product, when they know that there is a goodwill behind this production, and they believe that the whole process is not for profit. So they say, okay, this is a health system that only cares about the welfare of the society. is not working for profit. It's just about the health of the people. So in that case, people can trust it better. But when it comes to the companies, enterprises, of course, profit is a different factor, is an important factor. They need to look at the profit. So I see the nature of the work between university researchers and industrial entities a little bit different. Like in university, the research is mostly about a non-profit for the sake of research. But when it comes to industry, profit is involved. So the broker that you mentioned here has a difficult job to do, like just how to be sure that this connection is happening and the product is going out to the market only when it's mature, when it's reliable fully. Is not only about the brands, is not about the more profit of the companies, is not about just selling more, in this case, vaccines or, of course, other products. So the concept of for-profit or non-for-profit, I think, is something that affects the trust of the customers to even use these products.
And I can also complement your question, saying that there is this long term, mainly if there is no short-term profit, but there is some long-term profit. In the future, there will be profit. So how to manage this difference?
I think that's what was the most interesting thing about the production partnership for development, for production for development productive, the PDPs in Brazil. That we here in Brazil, I think it's probably because our Catholic background, we are ashamed of being profitable. We cannot make profits. But in our constitution, we say that the rights to have the health supplies and services are also a principle, just as the free market. So they cannot be. They have to live alongside. So, what do I think? We must say from the beginning that private companies want profit. There's no shame there. What we cannot do is deal some privilege for some companies instead of others. We need to provide equal opportunities for all them to participate of the project. But of course, some of them will have profits, others will not have. But if we think that the unified health sector will be only provided by government, we will have a problem here in Brazil, because we need the private sector. We need their strengths, industrial facilities, etc. So we must provide them opportunities to have profit. What we and in the other point related with science and technology, we need to share with them the risks of the development. So then, when we cannot see in a short term the opportunities of profits, that's what Mariana Mazzucato tells, that we need the state there to share the risks. When the products are profitable, we can send them to the private sector to be produced. After they have reached the final stage of the product life cycle, they come back for the government laboratories or infrastructure, because they are not capable anymore to provide profits. That's what we have to set this kind of policy. How to use, and there is also something very important. Health unified system already made those kind of purchases and legal tenders with huge amounts of expenditures. So once we convince, once the private sector agrees to transfer the technology to Brazil, we don't have an increase in the budget. We only use this budget wisely. So that's why there's no problem. They can make the profits. We can supply free drugs and services, and those things can live together.
I must thank you very much again, Rodrigo Silvestre. I think we reached the time. The parallel sections are starting, and we need to be there. Thank you very much for your nice talk, and everyone can reach you also. I think they have your contact, and thank you very much again.
It's my
Thank you
pleasure.
very much. Thank you. That was a great
Thank you.
presentation. Thank you.
I'm going to stop the streaming now.